How would you like to work in a small rural community where you get to know your customers by name? A place where students get the best education and a place filled with friendly neighbors and good people? Then check out Clark County's careers. Memorial Medical Center is a fast-paced environment with many career opportunities, working both directly and indirectly with patients and requiring various degrees of education. Let us begin with patient care services, which encompasses many career opportunities in all aspects of the hospital, emergency and surgical departments, clinic, and assisted living. Registered nurses are involved in many areas of the patient care services department. Registered nurses can be specialized in the hospital setting with acute care inpatients, in the emergency department, or as a surgical nurse. Clinic registered nurses help with triage between clinic, urgent care, and the emergency department. Registered nurses also specialize in case management, infection prevention, employee health, clinical education, and school nurse roles. Surgical technicians perform direct patient-centered technical scrub services as assigned by the registered nurse. They assist with the preparation of the operating suite by gathering supplies and equipment for the surgical procedure while establishing and maintaining a sterile field for the operating team. Surgical technicians are responsible for passing and anticipating instruments and supplies to other members of the surgical team. Certified medical assistants prepare patients for their appointments and provide assistance to the provider during the patient visit. Medical assistants are responsible for taking vital signs, documentation, specimen collection, assisting with suturing or casting, computer data entry, as well as many other tasks. Health unit coordinators are utilized in the hospital, emergency department, and surgical departments. They receive, process, and deliver patient care information required for the successful implementation of the interdisciplinary care plan through accurately transcribing and processing clinical orders, organizing the work environment, and coordinating services to patients and families. Emergency room technicians provide direct patient care and other department activities under the supervision of the registered nurse and other professional medical providers. They monitor EMS radio systems, enter lab and X-ray requests, prepare the patient, and assist the nurse and physician during exams. A certified nursing assistant provides direct patient care and other unit activities under the supervision of the registered nurse. Delegated duties primarily consist of assisting patients or residents with their activities of daily living, such as bathing, dressing, personal care, and recreational activities. The Department of Diagnostic Services encompasses three main areas of the hospital: diagnostic imaging, commonly called radiology, laboratory, and respiratory therapy. All diagnostic services perform testing based on orders placed by the medical provider. Let's look into the area of diagnostic imaging. Radiologic technologists perform necessary tests with the patient using X-ray, CAT scans, MRI scans, and mammography equipment. An ultrasound technician performs diagnostic ultrasound examinations for evaluation and treatment by a physician. They also perform bone mineral density exams. In the hospital laboratory, medical laboratory technologists and technicians are responsible for performing routine clinical laboratory tests to obtain data for use in diagnosis and treatments of diseases and illnesses. They may draw blood and collect specimens on both inpatients and outpatients to run tests and interpret the results. Phlebotomists are responsible for solely drawing blood samples from both adults and pediatric patients and may assist in lab support services. Respiratory care practitioners assist patients of all ages who suffer from pulmonary disorders. They also analyze and perform diagnostic testing, perform relevant exams, and control patients' blood oxygen levels, as well as set up and utilize cardiopulmonary equipment and machines needed to assist or monitor patients' breathing. Rehabilitation services, which encompasses physical therapy, occupational therapy, and cardiac rehabilitation, provides patient-centered services for those individuals needing musculoskeletal care and education on healthy living. A physical therapist plans and administers medically prescribed physical therapy treatments for patients both in the hospital and through outpatient clinic services, performing a variety of techniques to help patients improve range of motion, strength, and girth of limbs and balance while monitoring the effects of the treatments. Under the supervision of the physical therapist, physical therapy assistants administer active and passive manual therapeutic exercises and often work with heat, light, sound, water, and electric modality treatments. Physical therapy aides assist by providing patient transportation, housekeeping, clerical duties, and facilitation of physical therapists' initiated and directed treatments by preparing the patient for treatment. Athletic trainers specialize in caring for the physically active population through cooperative measures with physicians and other healthcare professionals. They work as a specialist in prevention recognition, evaluation and immediate care, rehabilitation, and reconditioning of injuries related to physical activity. Athletic trainers also work closely with schools to provide specialized coverage before, during, and after sporting events. The registered occupational therapist carries out occupational therapy interventions to hospital inpatients, outpatients, and assisted living center residents by evaluating the client's strength and treating the deficit areas. This may include motor, cognitive, sensory integration, and behavioral issues in people of all ages. Certified occupational therapy assistants implement the therapy programs and assist with treatments under the general supervision of a registered occupational therapist. A COTA must possess a working knowledge of the appropriate treatment needed to meet the patient's specific needs acquired through schooling and certification. A registered dietitian works collaboratively with physicians and patients in the clinic or hospital setting to determine proper nutritional guidance and provide educational training to the patient. Nutritional services aides assist in the provision of healthful diets to patients, staff, and visitors served at the hospital. They are responsible for proper storing of supplies, food preparation and service, and maintaining the kitchen. Memorial Medical Center is an equal opportunity employer. If you'd like to learn more about Memorial Medical Center and the positions available, visit their website at memorialmedcenter.org. If you'd like to learn more about Clark County, visit their website at www.clark-cty-wi.org.